Hi, I'm John Ashurst, and I am the Clinical Research Director at Kingman Regional Medical Center. And today, I'd like to talk to you about how the pandemics are actually nothing more than a diagnostic dilemma. First off, I want to begin with a case. I think that's really important because it really links this talk with what we see in the real world. So a case of a 28-year-old male who always has on a mask, had the vaccine, but now presents with a cough, difficulty breathing, fever, and aches and pains. So being a with him, notes he didn't want to go to the ER to end up being seen. So here in our town, we can actually go to a store and we can actually buy a rapid antigen kit. As you can see, it's the Abbott kit for the antigen testing, and you can see the cost there. It does have a sensitivity of about 60+% and a positive predictive value of 100% with a specificity of 100%. And what you do is you can use this rapid antigen kit at home, actually, and you do a nasal swab, and it comes with a reagent, and you touch the nasal swab and the reagent to a disc, and it gives you a result. The thing after this one patient did the test, as you can see, the control line is at the top, and there is a faint antigen line noted down at the bottom, so not a true negative. So at this time, it was unclear if this was an inconclusive result based upon the sensitivity of the test, or if it was a true negative or a false negative. So what we do, we got a second test and basically got the exact same result. So at that point, the patient then called me, given that I do most of our COVID testing at the hospital, and gave me these images to review. And upon my review and noting the symptoms of the patient, I felt it was best that the patient undergo a PCR test because of the inherent sensitivity of the Abbott test itself. So when I think of the pandemic, it's a diagnostic dilemma simply because, it is basically based upon a 2x2 grid. So whenever I look at it, in medicine, I want tests that are 100% specific, as well as having a very high sensitivity. If I could come up with a test that was 100% sensitive and 100% specific, that would be ideal. Especially, the PCR tests, those would be things that we can do in the hospital, but if we could come up with a rapid test that we could do at a patient's bedside, or if a patient could do it at home, that would be the best. So for those who don't remember, just remember that the sensitivity measures how often a test correctly generates a positive result for people who have the condition that's actually being tested. And the specificity measures a test's ability to correctly generate a negative result for people who don't have the condition that's being tested. So that's why this is so important as we keep in this talk. So moving on, so the different types of tests. So actually at our hospital, we did not reach that testing critical stage. During the early stages of the pandemic, we had numerous tests. The PCR test was the one that we used, which had a very high sensitivity as well as specificity. We also had the rapid tests, and then as the pandemic wave number 2 hit, we did switch over to antigen tests. However, the antigen test that we had also had a very high sensitivity and specificity. So just a little bit more detail on these. So remember that the PCR tests, it's a nasal swab. During the early stages of the pandemic, it took almost a week to get back results. towards wave number 2, we were doing in-house testing with a PCR. We get results back in about 6 hours. The test was highly accurate, and then it diagnosed people with active infections. So the antigen tests, these are the rapid tests that you may see across the country with a drive-up testing site. I can tell you at our drive-up testing site that I oversaw, we did the PCRs currently. We did do antigen tests at one point, but again, our antigen tests were a little different. They had a very high sensitivity and specificity. When you look at it, so remember that an antigen test is nothing more than an immunoassay that detects the presence of a specific antigen, which then implies a current in infection. You know, how long does it take to get an antigen test result? You know, not that long. The Abbott test that we looked at first, you know, we got results within a couple of minutes. And there's different sites across the country that you can basically just drive up and get your test, and they'll give you results within 10 minutes. You know, my big thing is with these, you know, it's antigen tests are more likely to miss an active infection as compared to molecular tests. So again, going back, so when we look at the sensitivity and specificity of the PCR, we're talking 99 plus for sensitivity, as well as a specificity of 100%. On an antigen test, we're talking somewhere with a sensitivity between 60 and 80%, depending upon the test, but most of them do have a specificity of almost 100%. So this is important, going back and looking at the 2x2 grid, right? So my research mentor told me that life is nothing more than a 2x2 grid. And when I think of it, that is basically pandemic preparedness also. So this is a great slide about this. So when we look at, say, you know, we're doing a test that has an 80% sensitivity and a 99.9% specificity. So if the prevalence of the disease is 1% in 100,000 individuals, then 200 of those people will have a false negative and 99 will be falsely positive. So I care about these false negatives, okay? Because those are the people during the pandemic that are still actively spreading the virus. So why is this important, and why should we care? So when I think of the next illness that sweeps across the globe, I want to detect people early on in their illness to prevent the spread. So in my mind, a pandemic preparedness, you need to be able to make accurate diagnoses at an early stage and successfully quarantine those individuals. The problem with COVID-19 is that many people were asymptomatic during the early stages of their illness. And we didn't have the test at that point in order to accurately diagnose those individuals. This also helps out with contact tracing. During the early stages, if we would have been able to appropriately and rapidly diagnose individuals, quarantine, and then contact trace with quarantine, that would have been the most ideal thing that we could have done. The other thing is, if we can do tests at home or at mass testing sites, where we can have a test back within 10 minutes instead of having to go to the ER or to the hospital, that would also help. Also, because whenever people come to the hospital, we saw a large number of infections spread amongst hospital staff and other individuals who were being seen in the ER for non-COVID complaints. One of the other things that I think about is that, you know, some of our data out of our hospital shows that the earlier that you give treatments, such, for instance, like monoclonal antibodies, in the course of an illness, the better the outcomes an individual may have. If we could accurately diagnose individuals at an early stage that have an illness and get them treatment as soon as possible, we could prevent people from being hospitalized. So in the closing, pandemics are nothing more than a diagnostic issue. Through the development of a rapid diagnostic tool that is accurate and it has very few false tests, that would be the next best steps in a pandemic. These are the people who helped me in my lab. I'd like to thank all of them. And if anyone has any questions, please just let us know.